On February 11th, the World Health Organization announced the official name for the outbreak that was first identified in Wuhan, China, as severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. This is what we more commonly refer to as the novel coronavirus, or simply COVID-19. The frontline workers at community medical centers for hospitals are continuing to do what they do best, working tirelessly to care for Valley patients. They are truly committed to keeping our community healthy. Some healthcare heroes took time out of their day to share their experiences through this pandemic.
Constantly, I'm there at the bedside trying to check in on the patients, seeing how they're doing, seeing if there's any simple needs that they need, because sometimes the simplest thing can go the furthest, and it's not necessarily anything that they need other than just some emotional support.
We really rely on each other more now than ever to either talk about it, to de-stress with each other, cry about it.
We know. Coming into this business, we know that we have to deal with it, but not at this rate and not at the extent of which we're seeing it. And the fact that, you're having 30-year-olds lose their life. It's heartbreaking. It breaks my heart. It breaks everybody's heart, in healthcare. To have your last conversation be on FaceTime.
I think the thing that gets us through this pandemic or this crisis right now is the fact that we walk shoulder to shoulder with each other. When things are getting busy and we're getting tired, we step in, we help each other out, we encourage each other. That's the huge thing.
To say that these are unprecedented times is an understatement. Our hospital system has faced a number of challenges over the past few months as we continue to battle the coronavirus pandemic. But it's the everlasting commitment to care that our staff embodies that keeps us pushing forward.
Frontline medical and support staff work long hours and extra shifts to ensure the hospital is prepared to provide care for everyone. Visit communitymedical.org/COVID-19 relief to see how you can support the ongoing efforts and frontline caregivers at community medical centers during this time. As the Central Valley's only Level 1 trauma center, community staff and physicians are trained and ready to take on big crises like the coronavirus. Dr. Thomas Utek is the System Chief Medical Officer at community medical centers, and he walked us through how community prepared for this pandemic.
It takes me back to a time which was very different for us. We certainly heard rumblings. I can remember being amazed that in Wuhan they could build a hospital so quickly. And never really transitioned to the fact that we'd have to do essentially the same thing here, or at least construct and have enough bed capacity for essentially another hospital within our hospital of COVID patients. Planning started in earnest in March. We started our incident command system/center. So we had a command center to do all of the disaster planning and used our emergency operations planning that we obviously plan and do drills prior to that, and so that came in handy. We certainly never have been in anything near this long or extensive, and then certainly it really came in summertime. Our worst month was probably July and August for when we were the fullest and the busiest related to COVID patients. The one thing that comes to mind is both for the patient and the family is the fact that they're separated. And we're still, as we're trying to reopen, we want to get our patients and their families and their visitors, appropriate visitors, to them as quickly as possible, but we need to do it safely. And it is truly a tragic thing to talk to patients and family who can't be with their loved ones in one of the most difficult times, whether they have COVID or another disease process. I'd say that was really a difficult thing. It continues to be a difficult thing for our staff and our patients and our families. I'm incredibly proud. I think sometimes people don't realize how difficult it is for everybody that's gone through this, and I apologize for the breaking down a little bit. I think for folks that go into medicine, this is why you do it. So that's really fulfilling. It's a time where you're able to actually demonstrate what you wanted to do with your profession, whether it's nursing or physical therapy or anything else. And this really allows you to show and give back to the community and why you trained and what you did.